All right, welcome to the podcast. Today's guest brings together years of clinical experience, leadership in hospital medicine, and a deeply personal transformation that led her to root cause whole person healing. We're honored to welcome Dr. Sabrina Patel, a board certified family medicine physician with over a decade of experience in both outpatient care and hospital medicine. She's the founder of ZIA Health, a concierge medicine and wellness practice where she blends conventional medicine with functional, hormonal, and lifestyle-based approaches to help patients achieve optimal health. Dr. Patel is trained in bioidentical hormone replacement therapy through BHRT Academy, a member of the Menopause Society, and a functional medicine provider with affiliation to the Age Management Medicine Group. She's completed medical training at the American University of Antigua and residency at Genesis Regional Medical Center through Michigan State University. During her time as a hospitalist, Dr. Patel served as an assistant medical director of her hospitalist program and completed 2 fellowships, one in healthcare leadership and then the other in hospital medicine. But it was her own personal journey that led her and truly reshaped her path, facing challenges that conventional medicine couldn't solve. She turned to functional medicine and hormone optimization, and the transformation was life-changing. Now, she's on a mission to provide the same level of holistic root cause care to others. Dr. Patel is also a proud mother of 2 toddlers, a loving wife, and a devoted daughter, all roles that fuel her purpose and passion for creating a healthier future for families and communities. Get ready for an inspiring conversation that bridges clinical rigor, personal growth, and practical insights you can bring into your own practice. Welcome to the show, Dr. Patel.
Thank you so much for having me, Ginger. I'm really
Oh,
excited to be here.
We're so excited to have you on the show. You know, it's becoming more mainstream now for MDs and DOs to have these functional medicine trainings in their toolbox, but there's still a lot that don't. And so I'm going to keep this podcast going until, you know, we get every MD or we get the medical schools to start incorporating it into the medical schools. That would be even better, wouldn't it?
That would be great.
So if you could share just a little bit, you touched on it in the bio, but if you could share a little bit about your professional journey into functional and integrative medicine, give us kind of a brief overview of the training path that you chose.
Yeah. So I started this functional route, I would say probably 2020, as actually during that COVID time period. That was also that transition for me for my own health. And that's when I got introduced to, functional medicine in terms of additional testing and trying to figure out how to solve my own medical concerns, because I got diagnosed with an autoimmune disease at that time, and not wanting to be on long-term biologic medications. I wanted to find different routes or things that I can do in conjunct to kind of help limit my flares. So that's how I first got introduced to functional medicine. So at that time, I was doing a lot of research at home, learned about different organizations that offer training. So that would be like IFM, A4M, and AMMG. I went to my first conference with AMMG, and I did their certification. Then I did A4M, and I'm in the process of completing their certification as well. So I kind of did, and I did courses with IFM. So I've done all 3 at this point, and I think after this I'm going to be like, okay, no more certifications. I think I've gotten enough, because it's just an evolving field. So the information is always new, so you have to keep on top of it. So the learning never really ends in this field. It's not like medical school where you did your 4 years. Yes, you have continuing medical education, but a lot of this information is so new and emerging, and it's growing on a day-to-day basis. So that learning is very different than traditional medicine, just because of the pace of how we're learning new things on a daily basis. But that's in terms of certification with the main groups that offer functional medicine. I have dabbled in all 3 of the main groups. Then for hormone replacement, they all teach hormone replacement within their courses. And then I did additional bioidentical hormone replacement with BHRT Academy. And then being a part of the Menopause Society, being updated with their information as well. So, trying to keep on top of it,
That's fantastic. And, I agree with you. I tell a lot of my docs, like, you don't need any more certifications, but you do need to continually keep learning, right? You need to
Yes.
continue doing your CMEs. You need to continue
Mhm.
going to the conferences, but you don't need another functional medicine fellowship. Once you've done
Yeah.
one,
Yeah.
just keep up with the continuing education, because you're right.
Right.
Science is advancing so fast that you have to keep going to these conferences every year. You have
Yes.
to keep up on
Yes.
the latest and greatest, but you don't
Yes.
need to have every
No, you
certification.
don't. Don't do what I did. You don't need all three or two. You only need one. And just understanding the basics and just keeping up with the new additional information that comes out.
Love it.
Yeah.
Love it.
Yeah. Yeah.
All right, so let's dive in a little bit. So, what are some of the most common root causes you see in your patient population, and how do you
Mhm.
address them?
So a lot of times, so even in my practice, there are four main pillars that I use where we're looking at hormones, how your body detoxify, gut health, and lifestyle. And truly, a lot of the concerns are hormones and gut health.
Okay.
That is the mainstay of most of the issues that I've been finding in patients. So, and even with hormones, there's always a gut health link to it as well. So I would say if I had to choose one area that every provider should try to understand and learn and really become very proficient in is gut health, because it leads to hormonal concerns, it leads to chronic diseases, it leads to insulin resistance, it leads to so many things. It's truly the initiator of a lot of diseases, and we don't realize that. So if I had to give any advice to any provider, it would be know gut health very well. It's a very vast topic. However, just try to learn it as much as possible. Try to become proficient in one testing. Don't try to do all the testing. Just become good in one company. Know that company, use that company, see all the patterns with many patients, and try not to do too many things at once, because then it gets very confusing.
I love that because it leads into my second question. So,
Hmm.
what labs or diagnostic tools do you find most essential for uncovering the underlying imbalances? So, since you're talking about gut, do you want to talk to them about the labs and the diagnostic tools that your
Yeah.
preferred choice?
Yeah. So the company that I use currently is GI Map for my gut testing. And I use it in conjunct with a food sensitivity test. And food sensitivity, I prefer like KBMO. They're a little bit more pricey, but I do like their lab results. There's Infinite allergy testing, that company as well. Those are the two that I would recommend. There are the two companies that have not just IgG, but they have multiple forms of IgG, and they have that complement levels. So if I feel like that's better information to kind of gear each wellness plan for a patient. It's definitely pricier, so that's definitely a consideration for patients. However, I prefer tests that actually give me a pathway to help patients feel better versus just a test that I can't really utilize the information very well.
Yeah. And if my doctor tells me, hey, I really would like you to get this test, I'm
Yeah,
not going to go, well, I want to save $100 and get the cheaper test. No, I want to give
yeah,
you what you need. So,
right, yeah,
I think, using the best, I mean, when it comes to your health, you can't cheap out on your health, right?
right, yeah. I mean, ultimately, the health is wealth, right?
Yeah,
And
absolutely.
you don't have a problem until you have a health problem, and then
That's right.
everything revolves around that. So the idea is that we want to prevent a health problem. So in
Right.
preventing a health problem, you have to invest in yourself. You have to invest in your health.
Right.
Yeah.
Yeah. I heard a cute social media quote that said, we have a million problems that we worry about, day to
Mhm.
day, but when your health is the problem, you only have one problem.
Yeah. Honestly, that is so accurate. It's 100% true. Yeah.
All right. So, can you share a story about a patient? You don't have to
Mhm.
mention names, but
Yeah.
whose life that you have seen significantly improved using functional or integrative medicine in your practice?
Oh
I know
yeah.
you've got a lot, but
I have had a
you have
few.
one that sticks out to
Um,
you.
So, I mean, I have a few with many different concerns. I feel like I could tap into multiple different areas.
Yeah, just pick
I
one.
I
Pick
would
one.
say, so she was about, if I'm not mistaken, maybe her early 30s.
Okay.
I don't, she was definitely in, yeah, early 30s, maybe 31, 32. and just been struggling with energy, fertility, weight, um, brain fog, and not just not feeling herself.
Okay.
So when she came in, very, sulken, even how she dressed, fully like covered in a lot of clothing. Like it was, it wasn't even like we're in Florida. It's not super cold. And she would have on multiple layers. But even just, body language, the way someone talks, the way they sit, how, just kind of, you could tell that there was insecurities and just, that motivation wasn't there. And she wasn't sure what was happening. She just didn't feel good. And her husband forced her to come in because he was just like, something is wrong. We don't know what it is, but something is off here. And at that point, she was doing GLP-1s with another provider and wasn't losing any weight on it. So that also was, demotivating for her. She just felt like, she was trying to do stuff to kind of get herself to feel better, and it just wasn't working. So for her, honestly, I remember when I met her, there were so many vague symptoms that I didn't really know where to start. And which I think a lot of providers would see, where when a patient comes to you, they've tried multiple other people prior, and they've tried multiple traditional things prior and got no answers. So when they come to you, it's a lot of exhaustion. It's a lot of fatigue in just terms of they've tried so many things and nothing is working. And they don't have a disease, or a labeled disease, but something is off, right?
Mm-hmm.
So as for me, I focus on 4 pillars all the time, every patient. And that's my guide in terms of how I practice. We're focusing on hormones, we're focusing on detoxing, we're focusing on gut health, and we're focusing on lifestyle. Something is going to work within those 4 pillars. Something is going to present itself within those 4 pillars. It always, so far, knock on wood, it has always been, something has shown up.
Sure.
Also, the testing are more extensive than that we do.
Sure.
The panels are more expanded, and our ranges for labs are normal. We are looking at optimal ranges, not just normal ranges. So we did that for her, and a few things was off. A lot of things were off for her, actually. Her adrenal glands were off. She was insulin resistant. I was actually concerned about possible PCOS just because her hormone levels were off, higher testosterone. We did gut testing. There was dysbiosis. So in terms of even, certain microbiomes that helps with GLP production and that balance, which explained why she wasn't necessarily losing weight with the GLPs.
Right.
So we started her on one of our wellness programs. And, once we started her on the detox, then we stopped the GLPs for a while. We started her on detox, changed around diet, and then we restarted the GLPs and they started to work, which was nice. Worked on her adrenals, worked on trying to cut down her testosterone level. So then she just slowly in front of my eyes, and she felt it too, just started to transform. Like literally when she walked in, now she just started to glow. And one day I looked at her, I was like, oh my God, you're like glowing. Your skin is glowing. And she's like, I know, I feel so much better. And, she was just like so thankful. And I was just like, yeah, this is why I do what I do. Just, it didn't happen like overnight. It was at least by the 4th month that we started to see that progress. And I think that's we have to have expectations for patients.
Sure.
By the time they see you, it took years for them to get to where they're at. Also, and we're doing stuff more naturally. So it's going to take, it's not a quick fix. So
right.
It's not something where, I just, start someone on metformin and their sugar, starts going down. And, it's not as simple as that. So, and it takes
everything takes time.
As well.
Everything takes time. I tell my doctors the same thing about marketing. Like it's not, in 2 weeks, you're not going to have people banging on your door.
Exactly.
It's going to take 3 to 6 months.
6 months
to really get the traction you want to see. So the same thing in medicine.
And consistency, right? So
yes.
But yeah,
so she's a happy camper.
Oh yeah, and she like refers and she tells everyone. Other providers are like, who she somehow are in relation to, they reach out to me wanting to meet me because, she's like speaking so well. And
That's great.
yeah,
I
it's
love
been
that. I
good.
love that story. So let's talk about some of the not so fun things about running a medical practice. So you come from traditional conventional medicine, you worked in hospitals, you know that system, you know the insurance system. So what are some of the biggest challenges that you have faced when you started, providing functional and integrative medicine?
So running a business, you have to have a business mindset. You have to. I am so used to patients asking about prices. I was like, oh, you have to go to the billing department. I don't know anything about that. Like, I'm just here doing my job, taking care of you. Did not want to know anything about insurance, did not want to know anything about copay, not my field, not interested. Now, as a business owner, I find that it was a hard transition where at the end of the day, it is a business, so I can't keep giving. I'm not at the point where I can do, charity. And I find that I was doing a lot than what I should have been. And it still happens, just because it takes time to transition fully to that thought process. And I am still within that first year of my practice. So I can't
And you're a
say I'm
nice
fully there.
person. You're a nice person. You want to help people.
Right.
My mentor always says, Ginger, you're running a business, not a nonprofit, right?
Exactly.
And it's
That's the right
hard.
word. Not
It's
charity,
hard.
but nonprofit. Right.
One of the consultants I had today, they said you have to take off your clinician hat and put on your CEO hat, right?
It is. But when you're in the practice, you find that you're juggling both at the same time,
Sure.
because you're the provider, you're doing the care, but also you have to switch over to, okay, this to that business cap and be like, okay, this is what it is, and keep boundaries, right? So you have to learn to be a good business person. You don't need to be nice. You have to be good at what you do, have boundaries. Yes, you want to be nice, but at the same time, not taken advantage of. And I think as providers, or innately, we just want to give. And that's where it becomes hard. I think businesses that have
I like
partners.
when you said that. You can be a nice doctor, but you can't be a nice business person because it's
No.
business. You have
Yeah.
to, you can't be
You have to
nice because
separate it.
they'll run you out of I mean, you'll be out of business.
Oh, yeah, easily.
Yeah.
They definitely will. Like, no doubt about that. And I learned that,
And it's
the
not
hard way.
intentional, it's not
No, it's
intentional.
not.
People are struggling, and so
Yeah.
of course you're going to hear the heart stories, but
Yeah.
there are other places that do provide, free care and for people that, are really destitute. So there are services there for those people.
Yes. Yeah.
So let's talk about some of the strategies that have helped you to build a successful practice. I know it's your first year, but I know the program that you're on, and I know that you're probably doing pretty well. So can you talk about some of the strategies that have helped you to build a successful practice so far?
So I would say if you can have a mentor. And when I say mentor, I mean, I think a lot of people take on the role of mentorship, but aren't true mentors. So you can have someone that's, they give you advice, and they may be like, maybe kind of like a teacher, but they're not a mentor. A mentor is someone, in my opinion, who's walking that process with you, helping you to figure out, glitches, and it's not just a one time, hey, what's your thought on this? And kind of give you a quick answer. They're getting to the nitty gritty of your practice and helping you get to where you need to be. And
so are you saying that you need a paid mentor to pay a professional mentor?
I definitely think paying someone to
Yes.
help you as a mentor.
Yes.
To get you through the first years of your practice, because you are going to make mistakes with or without a mentor, but you make a lot less with a mentor.
For sure.
Because it's still trial and error. Every demographic is different from where that mentor was, or what they know. And the time changes. But, having a mentor for me has been life-changing to get my practice started in terms of how to do it, a method from a business standpoint, because I I had no idea about anything with business. Truly, I did not know how to start it. What I know was insurance based, and if I was going to go insurance based, that's an easier transition, I think, for a physician to start a practice, because that's truly all we know. But I'd never had any business training, so having someone to help me through that process, I think, was life saving in a sense, where from a business standpoint, so I didn't just jump in and be clueless.
And it actually ends up saving you thousands of dollars.
Yes. Yeah.
Would you be okay? I'd be okay with you mentioning who your mentor is, because I happen to love your mentor. Do you want to mention who she is?
So she goes by Dr. Deb, but she's Dr. Deborah Matthews. She's out of North Carolina, and she has different programs, mentorship programs. She has one called the Practice Launch. She has one called the Practice Boost and Fill My Practice.
Yeah, I love
and I've
her.
done all three.
I've referred doctors to her. She's amazing.
Yeah.
And there are
great.
doctors that are really, like Dr. Deb. I don't know of any others that I would recommend, but we'll use Dr. Deb as the example. They're really proficient and really honed in on the business side, right? They're there.
Yes.
You're a good clinician. They already know that, but they really help you with the business aspect and all things about the business. And that's why I refer people to her as well.
Also, she still practices, right? So she knows the daily challenges. She has a practice. You can shadow her in her practice. You can see how a practice run. So you get a good visualization of how this, the possibility of what you can do, which is great. I think that's probably the best part, because you have so many places here. They're like, oh, we're going to mentor you, but they've never practiced. Right. They really don't know.
They don't have a practice.
Right. No, they really have no idea what it's like working with patients. And the fact that you can sit in on these consultations or these follow-up visits and talk to the staff and get a good, idea of how things are flowing from the back end to the front end, just every aspect of it. That is, nobody does that,
The doctor that I referred just went through the shadowing process, and she was like, oh my God, like life-changing, right?
I would pay so much just for that.
Yeah.
Over and over again. I still feel like I need it all the time. Like, wait, what did they do here again? What did they do in that part? Like, I want to go there all the time.
But let's talk also real quick on the other part of Dr. Deb's program, which I think brings so much value, which is the community. Do you want to touch on that for a minute?
Yes. So when you start a business, it can be very lonely, right? Extremely lonely, especially when you're starting out in hormones or functional medicine, which is not mainstream. Right. It is becoming more mainstream, thankfully. However, it's still the amount of providers that are in functional medicine in comparison to the amount of traditional providers is a vast difference. So when you're starting a business, having a community of like-minded people who are going through the same struggles or showing you the possibility of the wins that you can have, one, keeps you motivated, keeps you engaged, and you have someone who totally understands what you're going through. And that community and that bond that I've built with people I've met there, they're of lifetime. They're like family at this point. Like, we have conversations daily, whether it's a day where I'm like, oh my God, I don't think I can do this anymore, to today
I had a great day.
I did so well. And it's just like, we're cheering each other, we're in the lows with each other, and that is priceless.
Yeah, the community, the masterminding that you guys have, and the WhatsApp support. I just think that's like super key to what she's doing. And you touched on the fact that, it's not mainstream yet. There are more doctors going into functional integrative medicine, but what I think is the most challenging is that the patients aren't used to it yet, right?
Oh, yeah.
They're like, but I pay for this insurance. Like, why do I have to pay cash? And so when you have a community that can explain how they did it, how it works, and how to explain it to the patients, boy, does that make things easier.
Oh,
right?
Yeah. The community is, It's the best, truly. I don't
I love
even
it.
have the words to like
I'll have to
explain.
share this podcast with Dr. Deb.
Oh yeah, definitely.
So what advice would you offer to other traditional providers out there who are just beginning their journey into functional and integrative medicine? What advice would you give them?
I would say be open-minded.
I hear
First of
that so
all,
much.
yeah, no, it's true because I cannot, my health led me to this, right? And if it wasn't for my own health journey, would I be on this path? I don't know, because I was so scientific and traditional rooted that I needed to see the data. And functional medicine does have the data, right? It's just that we need to be open to it. Before it was had the connotation, oh, cuckoo medicine or whatever else
Right.
names, it's out there. But being open-minded and just go to one conference with no
Agenda.
expectations or no
Right.
agenda, and just see what they say. And you'll be surprised that once you start learning a little bit, you get so intrigued because these are things, even just basic nutrients that we did not learn in medical school. So you'll be so intrigued as you start hearing that I don't think you can actually stop because you're going to be like, oh, I want to know more.
Right. Because
So
you know intuitively there's something missing, right? And we
yes,
know now that this medicine is much more science-based
exactly.
than conventional medicine. And it's nothing against conventional medicine. There's still a big need for that as well.
Of course.
But the root cause, that's why we need the medical schools to start incorporating this because,
Yeah.
treating at the root cause is really what makes functional, I think, more science-based.
Yeah.
At least when you're talking about, primary care type of
Right.
diseases and stuff like
Yes.
that,
Yeah.
right? I mean,
Yeah.
we're not
Yeah.
talking about surgeries here. We're talking about,
Right.
when you're
Yes.
talking about primary care issues. So
Yes.
I
So
love
every
that.
primary care doctor, I believe, should have the functional medicine training as well. That's my opinion. Because now
Thank you
being
for
able to
sharing that.
incorporate both, it's so different in the practice.
It's the
Because
best of both
yes,
worlds.
if a patient has something and need antibiotic, I know exactly what to do, or from a traditional standpoint. But also now having the functional aspect as well, it just makes a whole world of a difference for them because now the conversation is changing, right? In how our dialogue happens in the clinic. So I do think from a primary care standpoint, having both, I think that should become standard. Surgeons.
I call you guys the primary care functional medicine MDs and DOs. I call you the Ferraris of the doctors, right? Because
I like that.
you're like the souped up model, right? You've got everything. You've got all the bells and whistles. So no, it's great.
Yeah.
All right. So what trends, there's so much going on, right? With the red light therapy and mitochondrial and all that stuff. So what are some of the things that you're most excited about that you see on the horizon? Like one of the things that you're kind of like, I'm going to do more, training in that.
So so right now I feel like I've been doing so much training
You're
up
like,
until this point.
you're
I'm
like,
like,
I'll
I
get the
think I need to
peptides
just take
later.
a little break. Yeah. I think,
That's okay.
peptides I'm definitely been doing training on peptides, but
Okay.
I would definitely want to do more there because
Right.
that's also very evolving.
Sure.
In terms of like gut health, hormones, I feel like I've done quite a bit there already. With
Good.
toxins, I refer out for like Lyme disease. That's just not what I want to specialize in. And I feel like if you're going to go toxin route, you should just focus on toxins. Like you have to niche down to become proficient.
Those are environmental medicine
Mhm.
doctors. Boy, are they have a whole nother level of it. I mean, that's a whole,
That's a whole different thing. Yes. So I'm just like, if someone has Lyme's or we're concerned about mold and Lyme,
sure,
I am referring you to
somebody
a specialist. Yeah, someone who's just solely focuses on that.
Fantastic.
I definitely am passionate about autoimmune disease just because I also have that. But in terms of what else right now, there's so many things coming out that, I personally want to focus. I don't want to focus on too many things.
No,
Where then it kind of just get lost in translation in terms of you're just doing too many things at once.
Agreed.
But I think I just want to perfect what I'm doing currently and perfect the business part, because that's the part that's the hardest. Truly.
Get the business under control.
Get
Yeah.
the business
And when,
under control.
and when you're ready to go do the autoimmune disease, I worked with a functional medicine MD that specializes in autoimmune disease for over 5 years, Dr. David Billstrom. And one of my doctors just took his autoimmune course, and she was like, oh my God, every doctor should take this. So I can connect you with him when you're ready. But you're right. You got to get your business. You have to make, the business has to make money. You have to be able to pay your bills. You got to be able to take care of your kids. That's got to come first. So I give you a lot of credit for saying, you know what, I'm going to focus on my business and I can do all of that later. You know, there's always more to learn. All right. And if there's one message you want listeners to take away about functional and integrative medicine, what would it be?
If there's one thing to take away, I feel like there's so much. I don't know why I'm having a hard time answering this.
Okay,
because one thing.
Right, it is a big question. So if it's one message that you want people to take away about functional medicine, you know, even for your patients, like what would it be?
That I really think is the mainstay of medicine in general. I think functional medicine is what medicine should be, where we're helping patients to truly prevent diseases, and also understand why things are happening.
Love it. And then for patients or other doctors that might want to reach out to you, what is the best way to reach you, Dr. Patel?
So they can always give my office a call, or our number is 386-359-0966, or they can email me directly at drsabrina@ziahealthwellness.com.
Fantastic. Or they can go to your website,
or my website, www.ziahealthwellness.com.
Perfect. Thank you so much for taking time out of your busy clinic and your busy life. I heard those sweet toddlers in the background looking for their mama. So, but I appreciate you taking the time, and happy holidays. We're both in red for Christmas. It's December 2025. It's December 19th. Oh my gosh. So thank you so much for taking the time out of this busy time of year to be with us today.
Yes.
Have a great night.
Thank you for having me.
Bye, Doc.